Everyone. Something we do a lot of, women's health, and specifically ovarian vein embolization. And some of this is controversial, some of this is out there as far as how aggressive should one be. I think everyone now agrees there's no question the entity of chronic, non-cyclic pelvic pain exists. The question is how best to manage it. So a lot of this early work, and I credit Lindsay here, who just spoke, on embolization of ovarian varices. About 2/3 of patients, women, benefit if they are carefully selected and have the appropriate constellation of findings clinically, which would be, in our case, we use MR as our imaging modality of choice, mainly to rule out other entities, recognizing that any imaging done supine is not perfect. And we don't have the ability to do MRI with a woman standing up, or for the most part CT or ultrasound with some exceptions. But if you do ovarian vein embolization, there's an improvement in about 2/3, some say higher, some say as high as 70–80%. The way you do it varies. I use sclerosant plus coils in the ovarians, and the question and the controversy remains, should you do the internal iliac veins? And how much and how to do it and so on is all differences in technique and stuff. Just because of our room setup, we tend to use a femoral approach, although one should definitely consider, if you're doing bilateral work, an internal jugular approach with a multi-purpose catheter, exactly analogous to what Lindsay just covered. We tend to do this on an outpatient basis. We used to stage it, doing ovarians, and then if they had pelvic floor varices, perineal varices, vulvovaginal varices, we would bring them back for another session. But now I get referrals from all over, and most women want to say, let's just do all 4 quadrants if you're going to do that, and be done with it. So that's what we tend to evolve to. And the results are, if you look at, and again, some work by Kevin Kim, a lot of these women have gotten worse with each subsequent pregnancy, and as a result of that, they want to avoid getting pregnant because they had such a bad experience in terms of pelvic, ovarian vein, perineal, vulvar, vaginal varices, so they don't want to get pregnant again. So they take all means to try and prevent that. As far as we know, there's no negative effects on this technique in terms of fertility, and it isn't done